evening, viewers. Dear ladies and gentlemen, this is a online talk arranged by Excellence Club Silchar, and today we have our distinguished speaker from Manchester, United Kingdom, Professor Mohan Chaudhari, who is a stroke physician and he is a retired doctor, and we are very glad to organize this kind of event. And I welcome all the viewers, all the ladies and gentlemen present here in this online talk. And now I'll request our Professor Devashish Bhattacharya, who will give the welcome address. So Devashish sir, please.
নমস্কার। আজকের এক্সেলেন্স ক্লাব আয়োজিত এই অনলাইন টক অনুষ্ঠানে যারা উপস্থিত হয়েছেন ইতিমধ্যে সবাইকে স্বাগত জানাচ্ছি। আমরা নিশ্চিত যে আরো বেশ কিছু শ্রোতা এবং দর্শক আমাদের এই অনুষ্ঠানে অংশগ্রহণ করবেন, আমরা তাদেরও স্বাগত জানিয়ে রাখলাম। আপনারা জানেন যে এক্সেলেন্স ক্লাব আসাম বিশ্ববিদ্যালয়ের শিক্ষকদের একটি প্ল্যাটফর্ম, একটি সংগঠন, যেখানে আমরা বিভিন্ন ডিসিপ্লিনের নানান বিদ্যায়তনিক বিষয়ে খোলামেলা মত বিনিময়ের উদ্দেশ্যে এই প্ল্যাটফর্মটি আমরা তৈরি করেছিলাম। এই যে অ্যাক্রস ডিসিপ্লিন এপিস্টেমোলজিক্যাল একটা বলবো কম্পোজিট ডিসকোর্স তৈরি করা, কম্পোজিট ডিসকোর্স তৈরি হয় ইন কোর্স অফ ইন্টারাকশন। এটা আসলে আমরা সবাই নানাভাবে এত ব্যস্ত থাকি যে সবসময় এটা সম্ভব হয় না, প্রত্যেকে নিজের ডিসিপ্লিনে আমরা আবদ্ধ হয়ে থাকি। কিন্তু প্রকৃত অর্থে আজকের দিনে জ্ঞান চর্চা যেদিকে তার জার্নি, যেদিকে সে যাত্রা করেছে, সেখানে আর ডিসিপ্লিন স্পেসিফিক বলে তেমন কিছু নেই। এবং আপনারা অনেকেই লক্ষ্য করেছেন যে ভারতবর্ষের যে নতুন জাতীয় শিক্ষানীতি সম্প্রতি ঘোষিত হয়েছে, সেখানেও এই ডিসিপ্লিনের ব্যারিয়ার গুলো ভাঙার পথেই নানাভাবে উচ্চারিত হয়েছে। আমরাও এই লক্ষ্যেই আমাদের এক্সেলেন্স ক্লাব, আমরা বিভিন্ন বিষয়ে, একটাই বিষয়ে বিভিন্ন দৃষ্টিভঙ্গি থেকে, বিভিন্ন জায়গা থেকে একটা পরিবেশ দেখা এবং তার যে জ্ঞানতাত্ত্বিক বহুমাত্রিকতা একটি বিষয়ের, সেটাকে আমরা অন্তরে অনুধাবন করা, আত্মস্থ করা এবং এই ডিসকাশন গুলোর মধ্য দিয়ে, এই অ্যাক্রস ডিসিপ্লিন বিয়ন্ড ডিসিপ্লিন আলোচনাগুলির মধ্য দিয়ে যেটা হয় যে নতুন নতুন দৃষ্টিভঙ্গি থেকে একটি বিষয়কে দেখার সম্ভাবনা খুলে যায় এবং প্রত্যেকটি ডিসিপ্লিনের লোকে সেভাবে উপকৃত হয়। এই করোনা মহামারীর পরিস্থিতিতে আমরা ভাবলাম যে নানান বিষয়ে অনলাইন টক এর টকশপ আয়োজন করি। এটা আমাদের একটা সিরিজ। এই সিরিজে আমরা নানান বিষয়ে বিবেকানন্দের যে দর্শনে শান্তি ও কল্যাণ, বৈদান্তিক দর্শন, এই সমস্ত বিষয়, কখনো দর্শন, কখনো সমাজ বিজ্ঞান এবং চিকিৎসা বিজ্ঞানের বিভিন্ন এক্সপার্টকে আমরা এখানে আমন্ত্রণ জানিয়েছি। আমাদের আমন্ত্রণে সাড়া দিয়ে তারা সবাই এসছেন এবং আমাদের নানাভাবে সমৃদ্ধ করেছেন। আজকে এই আমরা এর আগের যে শেষ যে বক্তৃতাটি ছিল, আমন্ত্রিত বক্তৃতা, সেই বক্তৃতায় অংশ নিয়েছিলেন, সেই বক্তৃতাটি করেছিলেন স্বনামখ্যাত চিকিৎসক শ্রদ্ধেয় শ্রী কুমারকান্তি দাস মশাই। আজকে রয়েছেন আরেকজন স্বনামধন্য চিকিৎসক, আমরা তার প্রফেসর মোহান দত্ত চৌধুরী। আমরা অবশ্যই এই আলোচনা থেকে নানা নতুন বিষয় জানতে পারবো। আজকের আলোচনার যে শিরোনাম সেটা হচ্ছে রেজিং অ্যাওয়ারনেস অফ কোভিড-19, the challenging the changing known to known unknown। একটা দার্শনিক এবং সাহিত্যিক অনুভবকে পাঞ্চ করে চমৎকার এই শিরোনামটি যে তৈরি করেছেন, সম্ভবত বক্তা নিজেই এই শিরোনামটি কথা ভেবেছেন। আমরা তাকে স্বাগত জানাচ্ছি। এখানে উপস্থিত রয়েছেন আমাদের সহকর্মী, গবেষক এবং বহু চিকিৎসা বিজ্ঞানের লোক, চিকিৎসক, বিশিষ্ট চিকিৎসক, গিরিধারী স্যারকেও আমি এখানে দেখছি। সবাইকে স্বাগত জানাচ্ছি, আমাদের সহকর্মীকে দেখছি। আমরা সবাই 1 ঘন্টা সময় ভালো করে কাটাই, একসঙ্গে কাটাই। এইটুকু বলে পুনর্বার সবাইকে স্বাগত জানিয়ে আমার এই সংক্ষিপ্ত বক্তব্যটি শেষ করছি এবং ডক্টর প্রদীপ্ত দাসকে, আজকের যিনি বিশিষ্ট আমাদের আমন্ত্রিত বক্তা, তার পরিচয় একটু সবিস্তারে তুলে ধরার জন্য তাকে অনুরোধ জানাচ্ছি।
ধন্যবাদ স্যার। এবারে আমি প্রফেসর মোহন দত্ত চৌধুরী মহাশয়ের জীবনের একটা সংক্ষিপ্ত পরিচিতি এখানে বলতে যাচ্ছি। Professor Dr. Mohan Datta Chaudhari is basically a stroke physician. He has 3 degrees in medicine from UK, Fellow of Royal College of Physicians from Ireland, London and Glasgow. Also, he is a Fellow of American College of Physicians, FACP. He was working as consultant physician and stroke physician in Stroke Unit, Manchester University, NHS Foundation Trust, UK, Honorary Clinical Professor of Medicine, University of Wisconsin, USA, Associate Medical Director, Stockport, NHS Foundation Trust, Greater Manchester, UK. He did his matriculation from Ramakrishna Vidyapith, Ramakrishna Nagar, which is native place of Professor Datta Chaudhary, in 1964. Did his intermediate from St. Xavier's College, Calcutta, in 1965, and completed his MBBS from RG Kaur Medical College, Calcutta, in 1970. Before leaving for UK in 1976, Dr. Datta Chaudhary worked for some time in Bardhaman Medical College, West Bengal. Now, almost every year, Dr. Datta Chaudhary visits his native place and serves for the rural people, providing them free medical treatment. Health services he worked in the health services in UK. His hobbies are playing piano, gardening and traveling around the world. So with that short introduction of Professor Mohan Datta Chaudhary, I am very glad to introduce him, and I would like to request Professor Mohan Datta Chaudhary to start his talk today. Professor Mohan Datta Chaudhary sir, please.
Thank you very much, Dr. Das, and also thanks to Professor Bhattacharya. Good evening, ladies and gentlemen, friends and colleagues. I need to declare first that I have no conflict of interest. I am by no means an expert in COVID-19 disease. So what I have gathered is from being involved remotely, indirectly, up to 6 people who have been affected, including one of my distant relatives from Silchar, and also learning from attending webinars like this and listening to World Authority on COVID-19 diseases. It's a new disease. I mean, Prof, would like to do some background work from what I have learned and listened to people, এটা তো সাধারণ মানুষের জন্য বলার কথা আছে, সেই জন্য আমি একটুখানি বেসিক জিনিসটা বলে তারপরে কোভিড-19 এ শুরু করব। So COVID-19 is the name of the disease. The actual virus that is called SARS-CoV-2 virus. That is very often সাধারণ লোকের মধ্যে confusion আছে। So what is a virus? The virus is a obligate parasite which depends on living cells. It is submicroscopic, তার মানে ordinary light microscope দিয়ে এটাকে দেখা যায় না, only electron microscopy, and normal variation of the size is 20 to 250 nanometer. You can imagine how small it is. Coronavirus is a type of virus, is a family of virus. There are several examples. Common cold is a coronavirus, and SARS, যেটা আগে এসেছিল, that is a coronavirus, and MERS, MEER, which is Middle Eastern Respiratory Syndrome, and now we have got SARS-CoV-2, that's the COVID-19. Virus has been there long before the mankind. Past history tells us that 3rd century recorded in Egypt, and the evidence is there from studying Egyptian mummies, that they had coronavirus. It spread in the 4th century to India, and then on 5th century to China. It came much later in the European countries. And Edward Jenner and Louis Pasteur are well-known Nobel Prize winner for discovery of smallpox disease, and vaccine, although they didn't know that this is a virus. Light microscope could not discover the virus, and electron microscope আবিষ্কার হয়েছিল, was discovered in 1931. In fact, the structure of the virus was not, full structure of the virus was not known until 1955. However, the question could be, how come then they were awarded Nobel Prize for vaccine? Well, Edward Jenner observed that milkmaid who developed cowpox did not develop smallpox. And from that observation, he took the bold step of separating the exudate from the smallpox lesion and exudate from the cowpox lesion. Then inoculated a 10-year-old boy with the cowpox. He didn't develop any particular disease, but few blisters or rash. After a while, then he injected the smallpox exudate, and that boy did not develop smallpox. So that was a brief history of discovery. It was not until 1886 that Adolf Meyer actually noticed that tobacco plants were developing some spotted disease of the leaves, and he thought that this is a tobacco mosaic disease. He still didn't know that it's a virus. Then came Dmitry Ivanovsky, who, by using the Chamberlain filter, separated the bacteria from unknown agent. In the sap, he used that, rubbing it against the tobacco leaves, which develop the same disease, tobacco virus or tobacco mosaic disease. And then he concluded, he along with his colleagues, that this has to be an infectious agent which cannot be filtered by using Chamberlain filter, and therefore it is an infectious agent unfilterable by the Chamberlain filter. That's all. And they named it, I don't know the rationale, but they named it virus. That was the first evidence of virus. Subsequently, as I said, 1955, when electron microscope came, full structure of the virus was produced. And now we know virus, different from bacteria, canona, it does not have any cell wall. It only has a protein, nucleic acid, either DNA, mRNA, or DNA or RNA, covered by a protein coat called capsid. That's its structure. And why it is an obligate parasite? Because it cannot, unlike bacteria, replicate and live without the living cell. To date, there are more plant viruses than human virus. Although human virus is increasing about 3 to 4 per year, new viruses are being discovered. And COVID-19 is one of them. I now want to move on to the clinical matters, and that is, how does this virus spread? Now, one of the things why it is so dangerous compared to the other coronavirus, because the spike protein, it is like a আমাদের বাংলায় যেটাকে বলে কদম ফুলের মতো, রাউন্ড স্ট্রাকচার, সেখান থেকে স্পাইক বেরিয়ে যাচ্ছে. That's why it is called coronavirus. Why? Because corona means crown in Latin. The same reason why arteries of the heart has been given the name coronary arteries, because when you remove the heart and leave only the arterial structure, it looks like a crown. So this is the coronavirus. It has a spikes from its surface, and that is the dangerous. It is called spike protein, highly antigenic. Initial story came from Wuhan city, Hubei province. It was not reported, and that story of the ophthalmology, eye specialty doctor, who tried to draw the attention of the authority, but he was not listened to, and unfortunately, gentleman lost his life. And then China reported it to the WHO, World Health Organization, only in December 2019. And as I say, changing known and changing known unknown, because if you follow the history of COVID-19, even WHO had given wrong messages to people in the beginning because nobody knew. So that now we know the spread occurs by air droplets, and also direct contact. If an infected person is within 1 meter, less than 1 meter with a non-infected person, then he can transmit the disease. কি করে? During coughing, sneezing, speaking, singing, any of this will transmit the disease. তবে scientifically proven distance is 1 meter. I have to tell my audience who are in India that UK is 2 meters. That is the scientific advisory committee's advice. And I totally agree, because it is difficult to measure the distance of 1 meter or 1.5 meters. Anyway, so spread occurs by asymptomatic patients, pre-symptomatic patients, and symptomatic patients. So asymptomatic patients are those, or persons are those who have no symptoms whatsoever, but they transmit the virus through the different mode of actions as I mentioned. What happens is COVID-19 disease occurs after the coronavirus SARS-CoV-2 has entered the nose, and the first home it finds in the nasal mucosa. There are ACE2 receptor cells, and it finds its home there. Now, as you know, the infection is host resistance or host immunity versus the offending infectious agent. That's the fight, and who wins. And that will depend on individual, lots of other factors. I'll come to that later on. If that does not progress further down the line in the respiratory tract, that patient most likely will be asymptomatic. তবে কথা হচ্ছে asymptomatic আজকে হতে পারে, come back in maybe 2, 3, 4 days, 5 days, 6 days, and that person can develop symptoms up to 14 days. That's the rationale of quarantine suspected people for 14 days. Quarantine কথাটা এসছে Latin. Anyway, so the issue is what is pre-symptomatic. অনেক সময় দেখা গেছে যে কিছু কিছু symptom আছে, they don't necessarily fall in line with the WHO listed symptoms. And I'll give you an example of a patient I have been involved quite heavily. Unfortunately, we lost the person. The other symptoms can occur in isolations. So WHO considered initially only few. How to suspect COVID infection? That was that fever, জ্বর, and they also put the marker that is 38 degrees Celsius that আমরা এখানে UK তে use করি unit, Indiaতে equivalent to 100.4 or more. But fever of unknown cause means there is no explanation. কারো যদি tooth abscess হলো কি অন্য কোথায় abscess হলো কিন্তু urinary tract infection, or they may have fever. The fever of unknown cause greater than 38 degrees Celsius or 100.4 Fahrenheit or more. 2, cough. এরকম cough, dry, continuous cough without cause. What do you mean by continuous? Patient is coughing continuously for an hour and at least has 3 episodes of that kind of episode in a day. Otherwise, a little bit of dry cough is not uncommon in normal people. And contact with a person. These were the initial. Now we know there are lots of other things that come out that was unknown before. One is that patient may develop loss of sensation. Another medical term for it is anosmia. And I know one person I have been dealing with suddenly reported that ধূপকাঠি, যেটা আমাদের ইনসেন্স জ্বালিয়েছে বলে ধূপকাঠিগুলো জাতা, কোনো গন্ধ নেই। আমি তখন সঙ্গে সঙ্গে বললাম no, you have lost smell sensation. তারপরে দেখা গেল যে another person became same symptoms, loss of sensations, nothing else. And he recovered within 2-3 days. So এই symptoms গুলো is very unusual, but হঠাৎ করে যদি এটা ডেভেলপ করে without any other cause, sinusitis হয়নি বা এসব হয়নি, অথচ loss of sensation is a very good marker. Loss of taste, ageusia যেটাকে বলে medical term. Particularly they lost sensation of sweet. আর এটা আমাদের ইন্ডিয়ানদের ক্ষেত্রে খুবই প্রযোজ্য, কারণ আমরা তো সবাই খুব মিষ্টি খেতে ভালোবাসি. If you lose sensation of sweet taste, it is a good marker. এখানে ইউকেতে দেখা গেছে নার্সিং হোম পেশেন্টস, আমার কলিগস যারা স্পেশালাইজ করছেন এখনো in medicine for older people, they have reported acute confusion, which is common in older people from other infections, but without other cause. Diarrhea, vomiting, persistent vomiting. এবং আমার একজন কলিগের রিলেটিভ, আমি ডিটেলস দেব না, he himself is a doctor. ওর হঠাৎ খুব ব্যাক পেইন and aches and pains, কিন্তু nothing else. He went to his consultant to say, can I be excused and I want to quarantine myself? He was refused because people didn't know. Within 2 days he became seriously ill, with then developed temperature and other things. Thankfully, he recovered. He had to be hospitalized, but he recovered. So these are some of the things. Constellation, clinical medicine is all about constellation of signs and symptoms, and you point to the probable diagnosis. But they must have a contact. Unless they have not got a contact, it is unlikely that they have got COVID-19 disease. So these are some of the pointers, but there are combinations. The one case that I mentioned before, I have been heavily involved, had hiccup. And I might told myself, what's going on here? Because only hiccup. And then he, of course, had vomiting, brief transient temperature, but hiccup, hiccup, and hiccup. I thought, well, this is unusual. It's not listed in WHO. Let me go through literature search, and I found one case report in the world literature of hiccup as the dominant symptoms of COVID-19. I have seen hiccup in my practice as a symptom of encephalitis, viral encephalitis. I have never known about this. I've asked the particular doctor who dealt with the person, and God bless, he's RIP, no longer with us. The doctor reports this case to the world literature because it is important for people to know that this can be a symptom, particularly persistent. I will now move on to the issue of prevention, which is the more important thing for us, particularly general people, to know. What can I do in this situation? And are there any other things we should have been doing and we didn't do? So one slogan, particularly in the UK and of course WHO, UK phrase is hands, face, and space. Hands means we should be doing hand washing. How? And I'm going to show you some demonstration. So we go there into the sink or wherever, and we just do this. That's it. No. There are altogether about 9 surfaces of both hands together, and people need to spend at least 30 seconds in my view, and also use, again, previously we were told by WHO alcohol is the only thing to use. Now we have been told that actually soap and water also kills the virus. But the technique is you have to make sure that you do this, you do that. Surgeons, and I know Dr. Kumar Das is here, they are very good at it when they go to the operating theatre. Proper cleaning of your hands, at least for 30 seconds, more the better. Now, how often? This is a question I've been asked by other people. How often? Well, very clear. If you've gone outside, before you enter your house, you should have either a small alcohol gel or something outside the house or in your pocket and use that. Before handling food, খাবার বানাবার আগেই বলতে হবে আগে হাত ধুতে হবে. That should be common practice, but we don't do that all the time. Before distributing food, and of course before eating, even if you are eating with knife and fork. And after eating, we don't have to be mentioned. So hand washing is proven to work in other infections, bacterial infections. And আমি হসপিটালে কাজ করেছি in the UK for 44 years now before my retirement, and I know we usually were very religious in Clostridium difficile infection, MRSA, other infection. So it shouldn't be too difficult for us to follow that, but general population need to be aware. Face, again WHO told us initially. I was stranded in Calcutta during the lockdown. I went to Chennai to examine at the MRCP, and then got to Silchar, Ramkrishnanagar, came back, and last day of the lockdown, before lockdown, I managed to fly, and so many stigmatization was done as if we were criminal. This is something I'm going to criticize heavily. Even my own sister-in-law told me, সাবধানে থাকো, ঘরে লুকিয়ে থাকো। কেন? যে যদি জানতে পারে ব্রিটেন থেকে এসছো, তাহলে তোমাদের টেনে নিয়ে গিয়ে কোভিড টেস্ট করে কোয়ারেন্টাইনে ঢুকিয়ে দেবে। যদিও আমরা by that time we have been in India for nearly 6 weeks, and that shouldn't be the case. It is another disease, it's another infectious disease, and we have to be careful that we don't stigmatize people. The prevention is whose responsibility? That's my question. Responsibility of individual. Why? I want to protect myself. আমি আমার ফ্যামিলিকে বাঁচাতে চাই, protect my family. I want to protect my friends. I want to protect the community. It's a serious responsibility, but sometimes people are not taking it as seriously. And next thing, apart from the hygienic measures, is exercise. Any form. You don't have to necessarily go out to do it if you don't want to. You can do exercise within your own home as long as you do something. It boosts the immunity. It does all sorts of other benefits. Whether diabetes has it, heart disease has it, they will all be benefiting from that. And exercise, khali je body exercise tha noy. Respiratory exercise, that is breathing exercise. Brain exercise, because people have become depressed, anxious, fearful. In the UK context, I can tell you many people have committed suicide. Suicide rate has gone up. Domestic abuse has gone up. So there are a lot of impacts of this disease. And more we can keep people in a healthy state of body and mind and lungs will be helpful. এবারে আমি একটা particular point focus করতে চাই. I'll give you some evidence for it. সেটা হচ্ছে prevention শুধু যে lockdown করে দিলাম without any plan, what will happen during the lockdown to the population, shielding people, even home quarantining people. It's got its many bad effects on people's health. Also, different governments just got the buzzword for lockdown, and then coming out, there was no plan down. And that's been quite a bad thing, in my personal opinion. And I will give you an example of a country who did not go into lockdown, and yet they have probably one of the lowest incidents, not lowest, but one of the lowest incidents, and that is Sweden. So how come? They didn't go into lockdown, and they were one of the lower incidents of disease and mortality. And that's where my vitamin D comes. And you can say, are you an expert on vitamin D? Answer is no. I know quite a bit about vitamin D from my past clinical practice and experience, also listening to. Only 3 days ago, I listened to Professor Joanne Manson, professor in Harvard University. She delivered a fantastic lecture on why people should be taking vitamin D and what is the evidence. I agree, যেটা আমরা medical science বলি randomized controlled trial in COVID-19 is not available. Most of them are observational studies. But I will mention one first clinical trial of vitamin D in COVID-19 disease. Now, Sweden কেন হয়নি? Sweden, আপনারা সবাই জানেন যে it is one of the coldest countries in the world. Very little sunshine, particularly in the winter months. So they have low vitamin status, or they had low vitamin status, and they gave massive vitamin D supplementation on a regular basis. Most likely, this observation proves that vitamin D status is important. There are other countries where vitamin D status are generally low. America, United States of America's recent studies have come out that 80% of the Black Americans have low vitamin D status. 40% of the general population in America, despite being a lot more sunny countries than UK, have got low status. Black and Hispanic people have 80 to 70% low vitamin status, which may well explain, apart from the healthcare system, why the mortality in the United States is still one of the highest, probably the highest. Even in India, where people think, I was talking to one of my Indian friends, said, well, India has got lots of sunshine. We don't need to expose ourselves to vitamin D synthesis in the skin, because যারা ডাক্তার কলিগ আছেন ওরা সবাই জানবেন, কিন্তু অন্য যারা নয় তাদেরকে বলছি যে you need full body exposure for at least 10 minutes. In dark skin like myself and others of my origin, they need probably longer, because dark skin usually does not absorb ultraviolet sunlight as does fair skin. If this cannot be done, because people are busy, weather may not be favorable, then recent publication from French National Academy observational study, they have recommended 1,000 units of vitamin D daily, which may be a little bit in excess. Then UK government and NICE together have produced guidelines that older people, particularly housebound or shielded or quarantined, that means they are captive in the house, they should have 400 units of vitamin D daily. They have not still recommended for general population, I don't know why. I am taking vitamin D. My wife, of course, has been taking vitamin D, and I am telling my children to take vitamin D. Because vitamin D has main function, যেটা vitamin D, সেটা হচ্ছে আমাদের বোন তৈরি করার জন্য। চিলড্রেনদের যখন বোন ক্যালসিফিকেশন হয় তখন ভিটামিন ডি ইজ ভেরি ইম্পর্টেন্ট। অস্ট্রিওম্যালেশিয়া বলে যদি ভিটামিন ডি এনাফ না থাকে। এই অ্যাকশনে ভিটামিন ডি অনেক দিন থেকেই জানা আছে, কিন্তু যেটা ইমিউন সিস্টেমে ভিটামিন ডি কি করে কাজ করে সেটা জানা নেই। It's a relatively recent knowledge, and people are doing lots of studies. একটা স্টাডি যেটা আমি বলেছিলাম randomized control trial, this was a Spanish trial published in Science Direct only recently. They took 13 patients in each group. One group was given along with COVID-19. These are all positive established diagnosis of COVID-19. Loading dose of vitamin D as soon as they were admitted to hospital. They were still in the general ward, COVID ward. And then other group was given standard treatment but no vitamin D. So they gave loading dose, তারপরে daily dosage in a lower unit. And they measured the outcome was death and intensive care admission, all things being equal. Small study, but highly statistically significant. No people needed intensive care admission, and no people died. Whereas যাদের vitamin D দেওয়া হয়নি, 50% needed intensive care admission, and many of them died. Not that many, because it's a small number. And যেটা statisticianরা use করে, usually p values was 0.001. তার মানে 1 in 1,000 chance that this may have been by chance. I was quite impressed by this study, although as I say, criticism would be it's a small number. This is the first clinical trial of vitamin D. So question would be, how does vitamin D work in this situation? Because একটা জিনিস যেটা হয় কোভিড ইনফেকশন হলে, there are 3 stages of COVID infection. First one is stage 1, যখন coronavirus গিয়ে lodge করলো ACE2 receptor cell, and then it stayed there, patient has no symptom. Stage 2, when patient is either pre-symptomatic or symptomatic. It's an arbitrary division. And stage 3 is when full-blown disease has developed and patient has now become pretty ill, either needing hospital admission or even intensive care. If you wait too long to give vitamin D, it's not going to work. That is the trial basis that they loaded any patient admitted to hospital with vitamin D, and then other group was not given. I don't know how ethical permission was obtained, but probably that there is no trial to prove or disprove the case. So when we get the virus lodged in our nose, then it will progress if our immune system cannot protect the replication of the virus. And by the way, virus does not, it's a clever virus. It attaches itself into the cell, and its spike protein, the highly antigenic protein, makes the machinery of our own cell to start replicating for them. যে কোনো ইনফেকশন হলে ইনফ্লামেশন হয়, আমরা মেডিকেল টার্মে বলি ইনফ্লামেশন। ইনফ্লামেশনেতে কতগুলো সেলস আছে আমাদের বডিতে, দ্যাট আর বেসিক্যালি ইমিউন সিস্টেম সেল। They start producing chemicals, and they are known as chemical inflammatory substances. অনেক রকমের আছে, তবে একটা যেটা খুব ওয়েল নোন, যেটা ইন্টারলুকিন 1, 6 and so on. কিন্তু সেটা কি করে হয়, আমাদের বডিতে যে ডিফেন্স মেকানিজমে লিম্ফোসাইট বলে একটা সেল আছে, তার দুটো ভাগ আছে। T cells, or thymus dependent cell as it was originally called, is divided into 2. One is the T helper cells, and the other one is T suppressor cells. Now, আমি এটাকে ভালো করে কনসেপ্ট করে বুঝেছি, is like accelerator in the car, the T helper cells, and T suppressor cells like a brake. কি হয়, usually body responds appropriately. It's like a dose response curve, appropriate to the dose of the infective agent. In the COVID situation কি হয়েছে, because of the high antigenicity of the spike protein, system can suddenly respond so inappropriately to produce the so-called cytokines. Cytos means cells and kines means movement, cytokines. These chemicals are liberated in huge amount, inappropriate to the dose of the virus. And instead of protecting us, this goes into a phase called cytokine storm. And it has been postulated that many of the patients do not recover because it is almost like a self-destruction. Vitamin D has been shown to be an immune modulator. It can upregulate or downregulate as is needed. And that's the connection that low vitamin D status will have lost that kind of acceleration and brake system. So this is briefly, without going too much into the details, that this is how vitamin D works. And I am all for vitamin D supplementation, doesn't matter whatever the government of the day says. And all countries, really, even Italy and Spain, this study I mentioned to you is from Spain, has been shown to have quite a high proportion, despite sunshine, of low vitamin D status. So I am worried about the timing, so I will move on to the next question about risk factors. So what are the risk factors? I have been a physician for older people as well as general physician and stroke physician. And it enrages me when people, anything, whether it is economics, whether it is societal disorder, whether it is no money or disease, first thing people come out and say, oh, AI, older people, they will get it, they will die. This is nonsense in my view. Age, and the Annals of Internal Medicine has published a couple of months ago a paper, and I read it thoroughly, that no, age itself is not an independent risk factor. I stress, age itself is not an independent risk factor. And this study very close to my heart has proven that. However, with age you develop many conditions. That's called comorbidities, and of course that will be a risk factor. So age plus comorbidity, definitely risk factors, the higher risk factor. But age alone, and আমাদের একটা ছোট্ট fact বলছি. There is a gentleman called, he's now called Sir Captain Moore. He was 99, retired army captain, and he decided that in this lockdown situation, I am now housebound. What can I do? I will do exercise. It will help me in COVID-19. I'll be exposed to sunshine, and I am going to raise money, fund, charity fund for NHS. And guess what he did? He walked miles and miles. I don't remember exactly how many miles, 100 miles or more, despite being 99-year-old, and he raised 40 million pounds for NHS. Look at this. So COVID-19 has not produced only negative things. There are many positive things. We have learned how to work differently, remotely. We have learned how to celebrate weddings, birthdays. And I know in the audience, my very close friend, Dr. Soumitra Banerjee is there. It was his birthday yesterday. And me and my daughter decided, what can we do? Obviously, he had some bad news from back in India. So we decided to go to his house. I baked a cake. We took it unbeknown to him in consultation with his wife, Chaudhari, Mrs. Banerjee, who is still in the audience. And we celebrated. We remained our 2-meter distance. We were wearing masks. And that's it. So this is a new way of celebrating, an alternate way of living, working and living. We have to learn that. That's also part of lessons. Now, I shifted away a little bit from the risk factor. So obesity is an independent risk factor. And of course the comorbidities, again, I have done some work in the past life on comorbidities. What even the physicians, clinicians list the diagnosis: type 2 diabetes, hypertension, ischemic heart disease. Oh, multiple comorbidities is going to be poor outcome. No. People don't measure what do they mean by comorbidities. So somebody who has got diabetes, his diabetes is well controlled, HbA1c আমরা measure করি, is well below the range that is required. He has got no complications, kidney, heart, lungs, blood pressure, কিছুই নেই. He is one kind of diabetes, and he is one kind of 74-year-old. Cannot be compared with another 74-year-old who has got heart disease, kidney disease and complications, diabetes with আমরা যেটাকে বলি retinopathy, মানে চোখ ইনভলভ হয়েছে, brain involved হয়েছে, heart involved হয়েছে, kidney involved হয়েছে. That's different. What I learned from my research in the past, there is an index of comorbidity called Charlson's Comorbidity Index, which American oncologists definitely use even in the UK, and some other clinical specialties like cardiologists, when they want to give different treatment. Cancer specialists want to give chemotherapy or something like that. They use the Charlson Comorbidity Index because they score the point differently for different complications that this patient has, although he may have one diagnosis. So this is how it should be measured, and then you will find out that no, age alone is not going to influence your outcome. In fact, I read an article in the New England Journal of Medicine. Too old for what? That was the question. It's a beautiful article, very, very old story, writing somebody of 88-year-old who had a heart transplant and sailed through it, lived for another 10 good years. So how is that possible if age was the only factor? And I teach that in my other lectures I have given in recent regional meeting, that don't think of age every day and die every day. Live today and then tomorrow will be a better day. Coronavirus context, do your duties. I should do my duties before I can give lecture to anybody else. That I don't do any exercise. I eat all junk foods. I don't wear mask. I don't wash my hands as the scientific advice suggests. I have no right to give lectures to anyone. Okay, so I want to talk, I don't know what time is left, Mr. Chairman. Quickly, I want to talk about what are the current treatments of proven efficacy and what are the treatments where we are going to do blunderbuss therapy, as I call it. Current treatment, glaring evidence is from recovery trial published in the Lancet in June 2020. They did randomized control trial, and conclusion was those people who received dexamethasone, very cheap drug, one of the cheapest drug you can find, every country, every hospital should have dexamethasone, 6 milligram a day for 10 days, either orally or intravenously. মুখ দিয়ে খেতে পারে যদি swallow করতে পারে, আর তা না হলে ventilated patient, you may have to give it either through NG tube or intravenously. As simple as that. Mortality reduction 30 to 35%. This, in medical terms, this is a significant achievement. তবে মর্টালিটি সম্বন্ধে একটা কথা বলি যে মার্ক টুইন বলেছিলেন, statistics and them lie. When it comes to an individual, when it comes to a family, as I have experienced in one of my distant relatives recently, one death is too many. It is 100% for that family. It is devastating. So we shouldn't always rely entirely on statistics. However, statistics is also helpful. This trial has proven that at least we can revive 35%, 30 to 35%. যে লোকগুলো 35% রেসপন্ড করেছে, হায়ার রেসপন্স ইজ দ্য মোর সিভিয়ার দ্য ডিজিজ, বিকজ ওই যে কথাটা বলেছিলাম আপনাদের, the cytokine storm is responsible and steroid will dampen or suppress যেটা ভিটামিন ডি করে, put the brake on the accelerator and decelerate. So that is how, in a simple term, dexamethasone works. However, interesting হচ্ছে যারা মডারেট হয়েছিল তাদেরও মর্টালিটি কমিয়েছে 20%, 25%, কিন্তু it is not to be used for people who have got mild symptoms, because steroid has got side effects. How do we know গ্রামে গঞ্জে যারা বাস করে ওদের অক্সিজেন স্যাচুরেশন কি করে কমে যাচ্ছে? আমি জানি আমার একটা নিজের ব্যাচ ফ্রম দ্য আরজিকর মেডিকেল কলেজ, আমরা হোয়াটসঅ্যাপ গ্রুপ আছে, অনেকেই এই বলছে ওকে ওই দাও, ওকে এই দাও। Pulse oximetry, how do you know oxygen saturation has dropped? Pulse oximetry, I used to be an endoscopist in the past. Unless you use pulse oximetry properly, we'll do faulty results there. Those people who don't know how to use pulse oximetry. আর পয়সা কোথায় লোকে? It's so expensive for ordinary people. There are remote villages active. But what can we tell them? That how do they know they're desaturating? Simple clinical guidance, and that is walking is very important for that. Somebody who walks 500, 600 meters a day now has got fever, cough, and now suddenly 3 meters, 4 meters, getting completely exhausted, no energy. Well, that person, in my view, is actually ডিস্যাচুরেটিং। কেন? এর সায়েন্টিফিক এক্সপ্লেনেশন আছে। কারণ আমাদের বডিতে দুই রকম মেটাবলিজম আছে, এরোবিক অ্যান্ড এনএরোবিক। যখন অক্সিজেন কমে যাবে তখন আমাদের মেটাবলিজম চেঞ্জড from aerobic to anaerobic. This is a body's mechanism. And it produces a lot of lactic acid, which will cause you the accession. So that's a proxy for pulse, expensive pulse oximeter and misleading results. Anxious patient ke pulse oximeter dao, you will find that they are reporting oxygen saturation is going down every day, and they are still alive 7 days later. Right? I have seen in my stroke clinic, not shame to mention, people do not measure oxygen saturation appropriately, despite training. People do not measure blood pressure appropriately. So, if you give a non-medical person, particularly I'm talking about not educated people in the cities, no disrespect to remote villages, they will start using it, spend all their money, and it's not a good idea. What else can we do apart from giving the dexamethasone and antiviral drug remdesivir? Now, remdesivir did not show reduction in death, but it did show reduction in the length of illness and length of stay in hospital. Still, some good outcome. Azithromycin was used, it did not reach statistical significance in that group. Now, big issue in treatment is chloroquine, hydroxychloroquine. And I have got annals of internal medicine almost building mountain in my house. And I got that article about 2 weeks ago. Use of chloroquine, hydroxychloroquine alone or in combination, treatment or prophylaxis. Conclusion of the narrative review from all the trials is that at best the evidence is weak, and at worst it causes harm. Chloroquine is a very good drug, and it has saved millions of lives in connective tissue disease like rheumatoid arthritis. But it's not without side effects. And you cannot use drug repurposing in this situation that it worked in rheumatoid arthritis, so why shouldn't it work in the virus? That's a wild assumption. So overall conclusion, and FDA has withdrawn their approval for use. UK never allowed us to use hydroxychloroquine and chloroquine for this purpose. So that is out. As far as UK is concerned, this is out. It's never been. Only in the context of research, maybe. আরেকটা জিনিস যেটা করা হয় প্লাজমা এক্সচেঞ্জ, আমার ex hospital বলবো এখন, I finished Manchester University Hospital, they have used plasma exchange with some anecdotal good results. But UK government বলেছে যে this is still not proven, you can only use in the context of research. আরেকটা যেটা জিনিস ইউজ করা হচ্ছে এবং রেকমেন্ডেড, যে এই পোস্টমর্টেম থেকে দেখা গেছে যে কোভিড-19 পেশেন্ট যারা মারা যাচ্ছে অনেকেই ক্লটস, যেটাকে আমরা বলি thrombosis, develop করেছে in different parts of the body, lungs, kidney, even brain. National Institute of Neurology থেকে রিপোর্ট করেছে massive stroke, cerebellar infarction as a result of COVID-19. So anticoagulation মানে thinning of blood prophylactically. কিন্তু কালকেই আমি একটা পেপার পড়লাম, সেটাতে ওরা দেখিয়েছে যে প্রোফাইল্যাকটিক ইউজ করা হয়েছে, nobody suspected any pulmonary thrombosis or embolism, clot, কিন্তু all the 11 patients at postmortem had evidence. ওদের কনক্লুশন হচ্ছে যে so what can we do? Yes, prophylactic use করতেই হবে, কিন্তু আর্লি স্ক্যানিং একটা স্পেশাল ইমেজিং আছে, সেটাকে বলে CT angiogram, blood vessel গুলো আউটলাইন করবে, can detect early and then you can change যেটা prophylactic ইউজ করা হচ্ছে সেটাকে থেরাপিউটিক ডোজে ট্রান্সফার করবে। আর তাছাড়া তো অক্সিজেন থেরাপি ইজ এ মাস্ট। যারা মোটামুটি করতে পারছে মেনটেন, শুধু নাকে ক্যানুলা দিয়ে করলেই হবে। তাতেও যদি কমে যাচ্ছে তখন আমরা এখানে এনআইভি, নন ইনভেসিভ ভেন্টিলেশন করা হয়। তাতেও যদি না হচ্ছে তখন ইন্টেন্সিভ কেয়ারে মেকানিক্যাল ভেন্টিলেশন সাপোর্ট দেওয়া হয়। তাতেও যদি কমে যাচ্ছে অক্সিজেন স্যাচুরেশন, ফাইনাল হচ্ছে মেশিন কল ইকমো, এক্সট্রা কর্পোরিয়াল মেমব্রেন অক্সিজেনেশন। এবার আমি মোটামুটি I am coming to the end of my talk, so I would like to summarize the key points, and that is COVID-19 is the name of the disease, not the name of the virus. The virus is called SARS-CoV-2. It is spread from person to person, mainly by droplets, 1 meter distance, and the general advice is 2 meter distance is better than 1 meter. And then incubation period is 2 to 14 days, the mean is 6 days. It is no certain whether asymptomatic patients can transmit, but now only last week I got a paper saying that yes, American study, crowd source studies that বলেছে যে যদি randomly test করা যায় তাহলে দেখা যায় যে about 40% people are asymptomatic and they do transmit the disease. ক্লিনিক্যাল ফিচার্স আমি আর রিপিট করবো না, বলে দিয়েছি কি কি জেনারেলি সাসপেক্ট করা উচিত। তবে একটা প্লি সাধারণ লোকের কাছে, কমিউনিটি পিপুলের কাছে, যে প্লিজ ডু নট অস্ট্রিসাইজ পিপল, ফ্যামিলি এন্ড থিং। আমি কলকাতায় অনেক ইনসিডেন্টস হয়েছে, যেটা আমার বন্ধু বান্ধবরা আমাকে জানিয়েছে, যে নার্স কাজ করতো, গ্রামের বাড়িতে ফেরত দিয়েছে, ওকে ঢুকতে দেয়, নট অ্যালাউড। You go and find a house somewhere else. তুমি গেলে একটা infectious disease hospital কাজ করে, so you shouldn't be coming here. This is wrong, in my view. It is another disease. I have seen it in my senior registered days when HIV came. They were ostracized, untouchable. There's a lot of stigmatization of the disease. It's another disease. Any of us can get it, God forbid. Elective treatment I've just mentioned is available, but supportive treatment is very important, especially in the very early days. I've mentioned to you the oxygen saturation ki kore clinically detect kora jete pare without pulse oximeter. But if you have a pulse oximeter, well and good, but there are dangers without training. So what is the future hold? Future hold, of course, the vaccine. And you know Oxford trial is going on, 1,000 patients have been recruited. Only one patient developed a side effect, but it has been proven that it was not linked to COVID-19 vaccine, and their trial has restarted. It is including United States and Brazil's people, and they aim to go on recruiting more. I've listened to our scientific advisor and chief medical officer's lecture only yesterday, and they're saying that progress is being made and the antibody response is good, and but no hope this side of the year, maybe middle of the next year, earliest April, if at all. A vaccine has to be safe, effective, easily available, and not costly, and it should be available for the global village, I call it. Poor country, rich country, highly rich country, everyone should have the access to the vaccine, and then only it will bring the pandemic down. We live in hope. In the meantime, what do? Adaptation and coexistence. We have coexisted with the virus for many years. In fact, there is another study which has told us, it's from the United States again, some sort of computational docking study saying that 30% of our body protein is as a result of adaptation during epidemic and pandemic. So there are positive things, and as I say, we have to learn to survive with adaptation, working differently, alternatively, socializing, celebrating in an alternative way. And I hope that my talk has given some food for thought to all of us. But I want to finish my talk by saying what Gandhi said, that if you wish to see the change in this world, you must be the change. Meaning, I'm giving big respect to you, and the next thing, when my turn comes, to wash my hands, I don't forget. Thank you, ladies and gentlemen, for listening.
Thank you, sir.
I'm happy. Yeah.
Uh, Very nice and elaborate lecture, sir, from your side.
Okay.
Sir, a few questions, sir, from our member participants.
Okay. Thank you.
Uh, so, starting from the first question, is 60,000 IU cholecalciferol capsules USP okay as a supplement once a week?
Yeah, I think cholecalciferol, thank you very much to the questioner. Cholecalciferol can be given in different ways. Dose is different for different situations. Ideal scientific way is to give a vitamin D status assay, which is expensive, and then if you find that person is deficient, then you have to give full therapeutic dose. Now, there are different ways of giving. Some people will give 300,000, but once in a month. Some people give 330,000 a week for 2 weeks, and then 15,000 for another 2 weeks, like that, combination of the doses. আমি যেটা বলছি সেটা হচ্ছে prophylactic. It's the difference between prophylactic and therapeutic. Now, one of the dangers of giving too much vitamin A also, they can develop side effects. Calcium levels can go too high and they develop what is known as hypertension. Recommendation from French National Academy is 1,000 units daily. UK NICE, UK government guidelines is 400 units every day. 60,000 may be unless the person is vitamin D deficient, maybe too much.
Thank you, sir. Dr. Amitabha Bhattacharya, are you there?
Yes, I am here.
Yes, please. You
So,
proceed.
good afternoon, sir. Thanks for,
Good afternoon.
yeah, this is Amitabh from Silchar.
Yes,
Sir, I
yes.
have a question.
I
Yeah, I have
remember
a question.
meeting.
Yes, sir. Recently in Silchar, we got few cases where the patient is having all the signs and symptoms of COVID, and when they have been tested by rapid antigen test, it was negative. RT-PCR, it was negative, but their CT test suggests that they have viral pneumonia. Now, my question is it another etiological agent, or are we missing cases through with our current diagnostic approach?
Yes, you are yourself a virologist, so you know that any test you do, there is sometimes false negative and false positive as well, it has been found. এখানে যেটা করছি তারা usually there are, I don't know what test you are using, but here it is for real time reverse transcript PCR. Now that takes a little bit time. Uh, One possibility will be your test is robust, in which case maybe the patient has a different viral pneumonia. Because remember, other viral pneumonia can also produce changes in the lung. Another problem of change that people always don't tell it. They may have had some chronic lung problem before, and they never had a test to check. And like pulmonary fibrosis, which is a good condition, and I know Giridhari is in the audience, is not always diagnosed. Not always diagnosed. It could be one possibility, a different disease, if the repeat test may be done. Other thing could be doing some antibody to see whether develop antibody or not. If the artificial, UKতে ওরা প্রথমে সিমুলেট করছিল আমার মেয়েই করেছিল antibody test. I told her, why did you do antibody test? It doesn't do anything. If you are negative, it doesn't mean you don't have it. If it's positive, yeah, okay. You may have had it and you develop. Does that reply your question?
Yes, sir. Thank you, sir. Thank you.
Thank you.
Thank you, Dr. Amitabh. We have another question, sir, from Dr. Partho Palit, Assam University faculty, that vitamin D, whether vitamin D as prophylactic therapy is required in this pandemic situation, whose serum level of vitamin D is normal range.
No. The answer is simple. If somebody has had the opportunity to check the vitamin D level, then that means that person doesn't have a low vitamin D status. Unlike from my reading and all the lectures I have listened to, as late as day before yesterday, if you have the opportunity and facility to do vitamin D testing, then and you have shown that vitamin D is well within normal range, then perhaps there is no studies that show that that is the case. I don't know whether prophylactic vitamin D in a normal person is going to boost the immunity. এই যে স্টাডিগুলো করেছে এগুলো সব লো ভিটামিন ডি স্ট্যাটাস people in the country. As সুইডেনের যেটা ওরা জেনারেল পপুলেশনকে দিয়েছে ভিটামিন ডি ফর মেনি ইয়ার্স, বাট তাদের কান্ট্রির সার্কামস্ট্যান্সেস ইজ ডিফারেন্ট, ওদের কোল্ড কান্ট্রি বললাম তো 3টের সময় 2টোর সময় 2:30টার সময় সন্ধ্যা হয়, সানশাইন উইন্টার মান্থে কোথায় পাবে? ইউকে কিন্তু বলেছে উইন্টার মান্থে ভিটামিন ডি সাপ্লিমেন্ট নিতে গুড আইডিয়া, and winter is coming fast in the UK. Thank you for the question.
থ্যাংক ইউ স্যার। আরেকটা এই কনটেক্সটে আরেকটা কোয়েশ্চেন আছে আমাদের একজনের, শাবনিক চৌধুরী, উনি জিজ্ঞেস করছেন যে is there any possibility of vitamin D toxicity if we start taking it without test?
No. Prophylactic dose নিলে it is unlikely that যে জন্য previous questioner যেটা আমি বললাম, current amount of high dose, there is a possibility. If we give 60,000 in one go, there is a possibility. Unless you follow them up with calcium. Main toxicity is high calcium. The high calcium হলে they will develop symptoms. খুব থার্স্ট হবে, যেটাকে আমরা বলি পলিডিপসিয়া, or খুব ইউরিন পাস করবে, যেরকম পলিউরিয়া, এগুলো হচ্ছে ক্যালসিয়ামের টক্সিসিটি। মানে ভিটামিন ডি তো ডাইরেক্টলি টক্সিসিটি করবে না, বাই রেইজিং দ্য ক্যালসিয়াম। তো যদি টেস্টিং এর ফ্যাসিলিটি থাকে, দ্যাট ইজ ফাইন, ইউ ক্যান ডু দ্য টেস্টিং এন্ড দেন ইউ ডিসাইড ইউ ওয়ান্ট টু গিভ ইট অর নট। But for mass population in countries where there is a low vitamin D status, Sweden, as far as my knowledge, there is no clinical reported toxicity on the prophylactic dose.
আচ্ছা, আরেকটা কোয়েশ্চেন আছে, ডক্টর অভিজিৎ মিত্র বলছেন যে স্যার প্লিজ হ্যাভ সাম লাইট অন প্যাসিভ প্লাজমা থেরাপি।
Yes, এটাকে বলে কনভালসেন্ট প্লাজমা থেরাপি। কনভালসেন্ট প্লাজমা থেরাপি আমার পার্সোনাল এক্সপেরিয়েন্স হচ্ছে আমার এক্স হসপিটাল, they have given separated plasma from the COVID-19 patients who have recovered and has got antibody test from positive. That means they have got, কারণ antibody আবার বেশি দিন লাস্ট করে না, আপ টু নাও রিকভারি ট্রায়াল এবং ইয়েতে এই ভ্যাকসিন ট্রায়ালে চলছে, দেখাচ্ছে last for about 8 weeks. So they have to have recovered from the COVID-19, but they don't have to go beyond 6 to 8 weeks so that antibody levels can go down. প্রচুর প্লাজমা ডোনেশন হচ্ছে ইউকেতে। যেটা বললাম যে ইউকেতে লাইসেন্স করেনি গভর্নমেন্ট, বিকজ they, you know, NICE is very cautious in licensing something, more cautious than FDA I find. So hope is that there will be enough plasma in the bank for treating only serious people, seriously ill people. So convalescent plasma therapy, USA has approved under FDA has got emergency code. Under emergency code, they have license. The UK has no license. They want you to enter patients in the trial and nationally collect the
আচ্ছা স্যার
results. That is the advantage we have got in the UK because we are National Health Service. So we cannot do anything we feel like. যেটা আমি দেখেছি without being, you know, kind of unkind, because of some of my patients, one of my own batchmate has recovered after getting ECMO. এখানে ইউকেতে এবং কলকাতায় যেটা মেডিকেল ফ্যাসিলিটি আছে, everything is injured, everything. Hydroxychloroquine, azithromycin, dexamethasone. Problem হচ্ছে যে it can do everything, but we don't know whether it is doing harm or good if it is not being proven to work. That's my concern. While plasma therapy probably will throw some positive light on the research, and it will probably have a role in the treating of COVID-19 patients, but cannot be recommended, at least in the UK, at the current stage.
থ্যাংক ইউ স্যার আচ্ছা
Thank
আরেকটা
you.
হ্যাঁ আরেকটা কোয়েশ্চেন আছে প্রফেসর অত্রি দেশমুখ্য উনি জিজ্ঞেস করছেন যে সিনিয়র সিটিজেন যারা আছেন বয়স্ক লোক যারা
Yeah.
ওনারা তো মানে ঘর থেকে খুব একটা বেরোন না কম বেরোন তো ওদের ক্ষেত্রে ভিটামিন ডি সানলাইট থেকে যে পাওয়ার ব্যাপারটা সেটা কতটা ইয়ে হয় আর কি এই জায়গাটা একটু যদি ক্লিয়ার করে দেন
Sure. Sunlight is very clear evidence is that if you expose yourself, expose মানে হচ্ছে full body, মানে ফেসটা আমাদের expose থাকে, arms, legs. একটা লোকে imagine করো wearing an underwear or short pants and rest of the body is exposed. 10 minutes is the exposure, but for dark skin like us, only 20 minutes is enough to get your 400 units a day, and you don't need supplement. যারা isolated ফ্ল্যাটে housebound বলে overstimulation of housebound বলে একটা term আছে, then you need to take prophylactic vitamin D. And current UK guideline 400 units a day, which is what I'm taking. I'm taking 1000 units 3 times a day because এখানে আবার vitamin D বেশি ডোজের খেতে গেলে you have to have a prescription. You can't get it over the phone. 400 units you can get, but এটাতে সেটা কোনো problem না. I would recommend nice যারা বলেছে UK government যারা বলেছে যে 400 units daily for those who are outbound cannot go for varieties of reasons and have exposed themselves in the sunshine. The old saying I say, Dr. Das, that only not dog and an Englishman go to the midday sun. Well, that's not true in this COVID-19 situation. If you can get a midday sun, I have done. Fortunately, our sunshine weather has been pretty good in August and September. So I have exposed myself, not every day, but every other day to sunshine, but I'm taking vitamin D as well. Thank you for the question.
থ্যাংক ইউ স্যার আরেকটা কোয়েশ্চেন আছে আমাদের এখানে is there any chance for COVID-19 susceptibility to those people whose serum IgE level unregulated beyond normal range due to hyperallergic sensitivity?
Okay, that has not been listed in the risk factor for COVID disease from my extensive reading and from the WHO. WHO, by the way, yesterday I got the WHO letter, newsletter, showing that 30 billion people have been infected worldwide and about 1 million, just 300,000 less, 1 million people have died. That is a report from different governments from different countries. Now I think, as usual, it is probably an underestimate. So, susceptibility for those who have got allergic IgE level, I think they can confuse people with the symptoms because you can sneeze, you can have a blocked nose and all sorts of things. I don't know whether it protects or whether it increases the risk. All I can say from my extensive reading of WHO newsletter weekly, there is
স্যার
no list for this condition to be a risk factor.
না
Thank you for the question.
স্যার আরেকটা কোয়েশ্চেন আছে
Bharati Sinha, is it?
হ্যাঁ sharing।
Asking a question.
আরেকটা কোয়েশ্চেন হলো গিয়ে স্যার ভ্যাকসিন সম্পর্কে আপনি তো অক্সফোর্ডের কথাটা বললেন, যেমন ভারতে এখানে ইন্ডিয়াতে মিডিয়াগুলো বা হয়তো মানে এমনিতে কথাবার্তার মধ্যে আমরা শুনতে পাচ্ছি যেমন অক্সফোর্ডের ভ্যাকসিন থার্ড স্টেজে নাকি কিছুটা মানে ফেলিওর এই ধরনের শুনতে পাচ্ছি, মানে এই ধরনের মিডিয়াতে কিছুটা প্রচার হয়েছে। আপনার কথা
No,
শুনলাম যেমন
no,
একজন শুধু পেশেন্টের সাইড এফেক্ট ছিল।
absolutely. Amra, we get coronavirus briefing almost. Initially, it was daily, but now every now and then the scientific people come, not the politicians.
হুম হুম
The latest is the 1,000 people have been successfully vaccinated, good antibody response. One patient, one in 1,000 patients, one patient had a problem. And as you know, the research style, Oxford General Institute is a very famous institute. Immediately they stopped the trial and they said, we pause the trial now, investigate the patient. And they investigated and found that this was a transverse myelitis, which is completely different cause, nothing to do with the coronavirus COVID-19 vaccine. So it has started, that's about a week or 2 weeks ago, the trial has started again. And they are recruiting from US and Brazil, and they probably will go up to 10,000 target. So it is progressing well, that is the latest. And some আমাদের এইখানে একজন হঠাৎ করে বলে দিল যে have you heard that the vaccine is coming to your previous hospital? They've been asked to get ready. I said, no. First of all, you have taken the credit, they've been Boris Johnson, Prime Minister. Because when recovery all came, rather than scientific people coming, he said, we are the first in the world and all that kind of thing, which is true. But he would have come, and I have not heard. তারপরে খবর নিয়ে দেখলাম, আমি মেডিকেল ডাইরেক্টরকে ফোন করলাম, ওরে জিজ্ঞেস করলাম কি ব্যাপার, বলে no, it was a briefing about COVID-19 that people should start getting ready to get influenza vaccination now. In case the vaccine becomes available, then you can't give influenza vaccination, COVID vaccination, if you have already had influenza vaccination. There has to be a gap of 3 to 4 weeks in between. That was the message, but it was misinterpreted in the UK. So there are, I heard that from Calcutta, somebody, my group, vaccine is coming. I think India is going to buy Russian vaccine. It is already available. Or Chinese vaccine. No, nobody has successfully completed the trial to claim that they have become the first one to discover the vaccine. No, not yet.
আচ্ছা আচ্ছা, আমাদের দর্শকদের মধ্যে একজনের কোয়েশ্চেন আছে যে ভ্যাকসিন তো মোটামুটি ধরুন মিড 21 এরকম সময়েই আসবে, এটা মানে এক্সপেক্টেড ডেট কিছু কিছু বলা আছে?
I have to tell your audience that last vaccine which was discovered in the measles vaccine, it took 4 years of hard work. 4 years of hard work. কারণ কি জানো, পবিত্র, one of the days of Jenners and Louis Pasteur, where you think it is going to work and you inject somebody with no control, nothing. They were lucky, they were right. But nowadays, so many breaks for research, they will not. Like, can you imagine one patient had a suspected side effect and immediately trial was paused? And that's the right thing to do. I'm not disregarding Janus, and he probably was a great man to save so many lives. But in those days, there was no electron microscope. He didn't know even it was a virus. So it will take to the if middle of next year vaccine available,
Hmm.
then I think we will be rejoicing, hopeful.
Hopeful.
So we have to live in hope. Thank you
Okay.
for the question.
ওকে, আচ্ছা আরেকটা কোয়েশ্চেন আছে আমাদের রিসার্চ স্কলার রোজি দাম কোয়েশ্চেনটা করেছেন, ইভেন আফটার ভ্যাকসিনেশন ওয়েদার দেয়ার ইজ এ চান্স অফ গেটিং ইনফেক্টেড, এরকম হতে পারে কি, মানে ভ্যাকসিনেশন নেওয়ার পরেও ইনফেকশনটা হওয়ার কোনো চান্স থাকে নাকি?
থাকতে পারে, থাকতে পারে। এবং কেন বলছি যে no vaccine can give you 100% protection. For example, তবে মুশকিল হয়েছে কি যে influenza vaccine is a good example, and I have done some work about people resistant to vaccine, even when evidence shows that it works. I had to convince people that, oh, I got influenza vaccine last year, flu vaccine, and I got flu. So I said, how do you know you got flu or you didn't have, common cold or things like that? দেখা গেছে কি যে even if you have a flu, you will have a modified flu. You will not have a full-blown flu where you are seriously ill. So that is the partial protection by the vaccine. আরেকটা জিনিস হচ্ছে যে who is talking about it, which patient we are talking about, person, older people, and we had a very good symposium last year, which we organized in the Northwest region, specifically for old people medicine. And I invited one of my public health scientists to deliver a lecture on vaccination in old people. And he gave a very good talk that antibody response in older people, which is true, that's where I will agree with the age issue, is dampened. So what it is, they don't develop antibody responses quickly as you gave it to a 25-year-old. But they do develop, it takes time. So the issue was, should be older people be given second dose of vaccine? Now, coronavirus COVID-19 vaccine is a trial that cholche, Oxford, they are doing that. They are including older people, young people, people with comorbidities. They are giving a second dose. And they are getting good, strong response with the second dose. So I think there might be a mild, and as you know, in the UK it is compulsory for anybody over 50 must be vaccinated against flu vaccine. Free of cost, of course, government will pay for it. Why? Because sometimes people bring flu, particularly healthcare workers, bring flu to the patient in the hospital. That was one of my research projects in the past. That can the staff bring flu to the patient? And answer is yes. So what do? You vaccinate all the staff. So this is a compulsory vaccination for all healthcare workers for flu and anybody over 50. But nothing in life is 100%. If you get the vaccination against COVID-19, it remains to be seen what the trial shows. You may still get, but you will not get the full dose. That's my understanding from influenza vaccination. Thank you for the question.
থ্যাংক ইউ স্যার। আমাদের সাথে আছেন আমাদের শিলচর মেডিকেল কলেজের ডক্টর গিরিধারী কর মহাশয়।
No, Giridhar is a good friend.
স্যার
I'm very good. I'm
গিরিধারী
very
স্যার,
grateful, Giridhar, for all the support is given to my family over the years.
So,
Thank you, Giridhar. You're welcome.
গিরিধারী স্যার যদি আপনি একটু ইন্টারেক্ট করেন আমাদের প্রফেসর মোহন দত্ত চৌধুরী স্যারের সাথে। গিরিধারী স্যার প্লিজ।
Hello.
উনি
গিরিধারী কি আছে?
হ্যাঁ ওনাকে পাওয়া যাচ্ছে না। আচ্ছা, আমাদের সাথে আছেন। আর কোনো কোয়েশ্চেন থাকলে কেউ করতেও পারেন ডাইরেক্টলি। মোটামুটি চ্যাট বক্সের যেগুলো ছিল কোয়েশ্চেন এগুলো অ্যাটেন্ড করা হয়ে গেছে। একটা লাস্ট কোয়েশ্চেন এসছে, ইফ এ ভ্যাকসিনেটেড পারসন ইজ ইনফেক্টেড উইল দ্য সেভিরিটি বি লেস?
Yeah, well, I've answered the question that
হ্যাঁ
I can't say at the moment because we haven't got the vaccine yet.
হুম
But
হুম
from the vaccination, yes, definitely you don't get the full-blown flu and become seriously ill. So hope is that antibody response is strong. Even if you get it, it's unlikely to be because your system is now tuned to tackle that virus.
স্যার এখন
Most
আমাদের
likely.
হ্যাঁ এখন আমাদের
Most likely.
স্যার
আরেকটা কোয়েশ্চেন এসছে whether the pandemic situation in India তারপরে চলে গেল কোয়েশ্চেনটা।
হ্যাঁ ওই কোয়েশ্চেনটাই মানে সবার মনে এখন তাড়া করছে যে প্যান্ডেমিক সিচুয়েশনটা কতদিন থাকবে এরকম
Oh wow. That's a $6 million question. Look, flu pandemic was 100 years, more than 100 years ago, 1918, 1919. I lost my grandfather. I heard the story from my father. He was a doctor and he said to people told him that you shouldn't go out and treat patients because you'll get flu. He said, well, I'm a doctor. I cannot stop treating patients, but unfortunately he died of flu. That story encouraged me to become a doctor. I think this is a very difficult ethical dilemma that whether, what was the question, sorry?
মানে প্যান্ডেমিকটা মানে আর
Oh,
কতদিন
yeah, yeah, yeah.
হ্যাঁ কতদিন
It last, let us say, New Zealand, Vietnam, I didn't mention that. Vietnam is done extremely well. It was the longest border with China, and they went straight into lockdown, strict lockdown, shorter period, and they have one of the lowest death in the whole world. New Zealand is another one. People are giving excuse, oh, their population is less. It's got nothing to do with less population. The fact that there are several factors. So pandemic seems to have come under control. China has controlled it. আজকের নিউজেই বেশ একজন এলাবোরেট করছিল কি হচ্ছে চায়নাতে, নিউজিল্যান্ডে, ভিয়েতনামে. So if we go by that, UK is now going to the second phase. Their cases have gone up, although mortality hasn't gone up. Intensive care admission hasn't gone up. So the theory now by our scientists here is that the virus is probably getting a bit muted as far as the UK is concerned. আরেকটা জিনিস হচ্ছে incidence is going up. Of course, if you do rapid testing for a lot of population, it will not be fair to compare the previous when there was no testing. If you are testing more people, you will find more people. But is the mortality going up? Is the hospital admission and ICU admission going up? In the UK context, no. Up to now, it is not. So pandemic will last 2020, and my guess is not my scientific answer, probably 2021. India has not even passed through the first phase. So I don't know India's second phase when it will come. But then your lockdown is different than the UK lockdown. Every country is doing differently.
আচ্ছা থ্যাংক ইউ স্যার আরেকটা এরকমই কোয়েশ্চেন এইটার কনটেক্সটেই আরেকটা কোয়েশ্চেন আছে যেমন উইন্টারে ফ্লু তো জেনারেলি বেড়ে যায় ইনফ্লুয়েঞ্জা বা ওই
Yes.
ধরনের অসুখ তো করোনা কি বাড়তে পারে এটা একজন করেছেন কোয়েশ্চেন
No. From my reading and everything, I don't think there is any absolute proof. Only thing why the government is our government is asking to have vaccination all healthcare workers and anybody over the age of 50, irrespective of the comorbidity. তার কারণ হচ্ছে ফ্লুর অনেকগুলো symptoms যেগুলো হবে, it will confuse people and people will then be rushing to have tests. Left, right and center system cannot cope. UK তে যেটা হয়েছে, because it is free, some people they've been told that if you don't have symptoms, please don't jam the system, and they have done that. At least that's explaining that they have all asymptomatic patients have gone for testing out of fun, and we cannot now cope with the testing system. One of the drawback of making everything free. So one of the conclusion would be, is it flu or is it COVID-19? So if people are vaccinated, very unlikely that they will have flu and therefore those patients should be asked, have you had vaccination? Yes. Well, in that case, maybe you should do COVID-19 testing. বাট ইন্ডিয়ার কি সিচুয়েশন আমি তো জানি না, আমি তো আমার ভাইকে জিজ্ঞেস করেছিলাম, বললো না এখানে তো ওরকম কোনো, তোমাদের কি রেগুলার ইনফ্লুয়েঞ্জা ভ্যাকসিনেশন হয় এভরি ইয়ার?
না।
না, আমার তো মনে হয়, well, that might be a political question. I think people should do vaccination this winter because of the confusion it will cause if you don't have to vaccinate. I don't know even how expensive it is in India. It's cheap, very cheap in the UK, even if you buy privately.
এমনিতে একটা ভ্যাকসিন গত 2-1 বছর আগে দিয়েছিল, এটা হলো ওই জাপানিজ এনকেফেলাইটিস। এটা মনে হয় জ্বর কিছু টাইপের কিছু ইয়ে।
হ্যাঁ, it's an encephalitis, Japanese encephalitis.
হ্যাঁ, ওইটা ভ্যাকসিন মানে স্কুলে টুলে দিয়েছিল আর কি গত 2 বছর আগে এই।
But why didn't they? Flu is every country has got flu, so I don't know why they're not promoting flu vaccination. Because it will cause a right confusion in the winter when it comes, and people will become anxious. And people will want to know whether they have got COVID-19 or not. But if they have flu, then the COVID-19 test will be negative. It's unlikely you'll get two viruses at the same time. That's another theory of virology.
আচ্ছা, আমাদের মোটামুটি কোয়েশ্চেন শেষ পর্যায়ে। আমাদের চেয়ারম্যান স্যার একটা কোয়েশ্চেন করেছেন, ডক্টরস আর সাজেস্টিং টু টেক ivermectin particularly to health workers.
No.
What is the
I
rationale?
would, yeah, I would strongly recommend, that is not correct. Because ivermectin, আমি ওই একটুখানি সার্চ করেছিলাম, is an anti-parasitic drug which has done a good job in saving millions of people's lives. There are lots of parasitic disease, Onchocerca volvulus, Sarcoidosis spondyloides, loa disease, অনেক রকম disease, and it has done a fantastic job. The problem is, ivermectin has been promoted. There was a kind of a in vitro study, I think it is from Japan. They petri dishes the coronavirus, SARS-CoV-2 culture করে তার মধ্যে ivermectin দিয়ে দেখেছে it kills the coronavirus, SARS-CoV-2. This is in vitro study. It's not been even studied in animal. It has not gone through any human study as far as my reading goes. And I've read it only, I would say, a week ago. Somebody asked that question to Dr. Das. Ivermectin will not be allowed in the UK. It's an experimental drug, and I don't think people should. I don't know even how much the cost is. But it's an in vitro study. I studied very carefully to say what is happening with ivermectin. People are using ivermectin in India, I know. But as I say, they are using hydroxychloroquine, monoclonal antibodies, or knows what else. Personally, I don't really endorse that practice because that may backfire on you. You don't know what killed the patient. Use the drugs that are of proven efficacy. Vitamin D, I would recommend. If you can get the test, well and good. But if you can't get the test, then, prophylactic dose, 400 units as suggested by the UK Scientific Committee of NICE and the government, it will not cause toxicity. Unless you are very religiously exposing yourself to the sun at least 20 minutes a day, then you don't need prophylactic vitamin D.
থ্যাংক ইউ স্যার। তাহলে মোটামুটি আমাদের প্রশ্ন পর্যায়ে এখানে শেষ প্রশ্ন পর্ব। আশা করি সবাই মানে আমরা প্রবুদ্ধ হয়েছি আপনার পুরো লেকচারটা শুনে, এবং মোটামুটি কোয়েশ্চেনগুলো সবগুলোই অ্যাটেন্ড করা হয়েছে। তো এবারে আমি রিকোয়েস্ট করব প্রফেসর পার্থঙ্কর চৌধুরী, আমাদের এক্সেলেন্স ক্লাবের তরফ থেকে উনি ভোট অফ থ্যাঙ্কসটা অফার করবেন। স্যার, আপনার পারমিশনটা নিয়ে নিচ্ছি আগে। মোটামুটি শেষ হয়েছে তো আপনার, if you permit sir, with your permission, due permission.
Yes.
Okay.
Yeah, yeah. If there are no questions, you have done well in organizing this, and I would like to thank you. Thank Professor Bhattacharya and all your members of the Excellence Club Committee for giving me the opportunity to participate in this. And I hope that um, even if 10% people, general people, I'm talking, there are educated people, those who are um, well tuned, is different. But I think the message should go to the villages, cities, towns, small towns, to people to say you have a role to play. The one single message is it is your right and duty to protect yourself and protect your family member and protect your friends and countrymen, community, and you have a role to play. That's the message.
থ্যাংক ইউ স্যার। তাহলে
Thank you.
হ্যাঁ, এবার আমি প্রফেসর পার্থঙ্কর চৌধুরী স্যারকে অনুরোধ করছি আপনি ধন্যবাদ জ্ঞাপনটা ইয়ে করতে, অফার করতে। প্লিজ পার্থঙ্কর
Thank
স্যার।
you.
পার্থঙ্কর স্যার।
ধন্যবাদ প্রদীপ্ত, and special thanks to Dr. Professor Mohan Datta Chaudhary for such a brilliant talk. In fact, after your deliberation, several food for thought have entered in the back of our mind. You have highlighted various issues like vitamin D, how it acts in the immune system. You have spoken about the proven efficacy also, cytokine storm. This aspect you have highlighted. The ECMO, that is which is I think it is not available in our town, but in some places in India this is available, and this is the I mean at the critical hour this is the need for patient. This is the need for patient. I think our healthcare system, especially in our city, it should go for that. And the various nitty-gritty about this COVID-19 scenario you have highlighted, we are really thankful to you. We are really thankful to two other renowned physicians of the area, Dr. Giridhari Kaur and Dr. Kumar Kanti Das, who have also spared their valuable time in the call which has been given by Excellent Club. I see in that in the gathering that there are about 70 participants from different parts of our country and also from other abroad also. Special thanks to all of them for your time that you have given, and the message that has been given by Professor Datta Chaudhary. If the messages are being percolated to the general community, I think in that case this initiative and similar such initiatives which are taken by Excellence Club, those initiatives will be fulfilled. Without further words, I once again extend sincere thanks to Professor Mohan Datta Chaudhary, who incidentally, the elder brother, not incidentally, actually is the elder brother of our friend Professor Manavendra Datta Chaudhary, and who Professor Mohan Datta Chaudhary we have met whenever he comes to Silchar and Ramakrishna Nagar on all the occasions. Thank you, sir, for your valuable time and the brilliant lecture. Thank you, sir.
Thank you. You're welcome.
থ্যাংক ইউ পার্থঙ্কর স্যার। তো মোটামুটি আমরা আজকের প্রোগ্রামের শেষ প্রান্তে। আমরা এক্সেলেন্স ক্লাবের তরফ থেকে সবাইকে ধন্যবাদ আজকে অনলাইন হওয়ার জন্য, আপনাদের মূল্যবান সময় আমাদের প্রোগ্রামের জন্য দেওয়ার জন্য, এবং স্পেশাল থ্যাঙ্কস টু প্রফেসর মোহন দত্ত চৌধুরী স্যার, who has given his time, very much valuable time in this pandemic situation. So on behalf of Excellence Club, we thank all of you for joining today in this online talk. So Shubharatri, good night to all.